Depression is a medical condition that affects your mood and ability to function. Depression types include clinical depression, bipolar depression, dysthymia, seasonal affective disorder and others. Treatment options range from counseling to medications to brain stimulation and complementary therapies. What is depression? Depression is a medical condition that affects your mood and ability to function. Depressive symptoms include feeling sad, anxious or hopeless. The condition can also cause difficulty with thinking, memory, eating and sleeping. A diagnosis of major depressive disorder, clinical depression, means you have felt sad, low or worthless most days for at least 2 weeks while also having other symptoms such as sleep problems, loss of interest in activities, or change in appetite. Without treatment, depression can get worse and last longer. In severe cases, it can lead to self-harm or death. Fortunately, treatments can be very effective in improving symptoms of depression. How common is depression? Depression is common all over the world. Healthcare providers estimate that nearly 7% of American adults have depression every year. More than 16% of U.S. adults, around 1 in 6, will experience depression in their lifetime. What are the types of depression? Healthcare providers name depression types according to symptoms and causes. These episodes often have no obvious cause. In some people, they can linger much longer than in others for no clear reason. Types of depression include major depressive disorder, MDD. Major depression, clinical depression, has intense or overwhelming symptoms that last longer than 2 weeks. These symptoms interfere with everyday life. Bipolar depression. People with bipolar disorder have alternating periods of low mood and extremely high energy, manic, periods. During the low period, they may have depression symptoms such as feeling sad or hopeless or lacking energy. Perinatal and postpartum depression. Perinatal means around birth. Many people refer to this type as postpartum depression. Perinatal depression can occur during pregnancy and up to 1 year after having a baby. Symptoms go beyond the baby blues, which causes minor sadness, worry or stress. Persistent depressive disorder, PDD. PDD is also known as dysthymia. Symptoms of PDD are less severe than major depression. But people experience PDD symptoms for 2 years or longer. Premenstrual dysphoric disorder, PMDD. Premenstrual dysphoric disorder is a severe form of premenstrual disorder, PMS. It affects women in the days or weeks leading up to their menstrual period. Psychotic depression. People with psychotic depression have severe depressive symptoms and delusions or hallucinations. Delusions are beliefs in things that are not based in reality, while hallucinations involve seeing, hearing, or feeling touched by things that aren't actually there. Seasonal affective disorder, SAD, seasonal depression, or seasonal affective disorder, usually starts in late fall and early winter. It often goes away during the spring and summer. What causes depression? Various factors can cause depression. Brain chemistry. Abnormalities in brain chemical levels may lead to depression. Genetics. If you have a relative with depression, you may be more likely to become depressed. Life events. Stress, the death of a loved one, upsetting events, trauma. Isolation and lack of support can cause depression. Medical conditions. Ongoing physical pain and illnesses can cause depression. People often have depression along with conditions like diabetes, cancer and Parkinson's disease. Medication. Some medications have depression as a side effect. Recreational drugs and alcohol can also cause depression or make it worse. Personality. People who are easily overwhelmed or have trouble coping may be prone to depression. What are the symptoms of depression? Depression can affect your emotions, mind and body. Depression symptoms include feeling very sad, hopeless or worried, not enjoying things that used to give you joy, being easily irritated or frustrated, eating too much or too little, changes in how much you sleep, having a difficult time concentrating or remembering things, experiencing physical problems like headache, stomachache, or sexual dysfunction, thinking about hurting or killing yourself. If you or someone you know has thoughts of hurting themselves, please call the National Suicide Prevention Lifeline at 800.273.8255. This national network of local crisis centers provides free, private emotional support to people in suicidal crisis or emotional distress 24 hours a day, 7 days a week. How is depression syndrome diagnosed? Everyone may feel sad or down from time to time. However, clinical depression has more intense symptoms that last 2 weeks or longer. To determine whether you have clinical depression, your healthcare provider will ask questions. You may complete a questionnaire and provide a family history. Your healthcare provider may also perform an exam or order lab tests to see if you have another medical condition. Management and treatment. How is depression syndrome treated? Depression can be serious, but it's also treatable. Treatment for depression includes self-help, regular exercise, getting enough sleep, and spending time with people you care about can improve depression symptoms. Counseling. Counseling or psychotherapy is talking with a mental health professional. Your counselor helps you address your problems and develop coping skills. Sometimes brief therapy is all you need. Other people continue therapy longer. Alternative medicine. People with mild depression or ongoing symptoms can improve their well-being with complementary therapy. Therapy may include massage, acupuncture, hypnosis, and biofeedback. Medication. Prescription medicine called antidepressants can help change brain chemistry that causes depression. Antidepressants can take a few weeks to have an effect. Some antidepressants have side effects, which often improve with time. If they don't, talk to your provider. Different medications may work better for you. Brain stimulation therapy. Brain stimulation therapy can help people who have severe depression or depression with psychosis. Types of brain stimulation therapy include electroconvulsive therapy, ECT, transcranial magnetic stimulation, TMS, and vagus nerve stimulation, VNS. Prevention. Who is at risk for depression? Depression can affect anyone, no matter their age, gender, or circumstances. About 16 million Americans experience depression each year. Women may experience depression more often than men. And your genetics or other health conditions can increase the likelihood that you'll have at least one depressive episode in your lifetime. Can depression be prevented? You can help prevent depression by getting enough sleep, eating a healthy diet, and practicing regular self-care activities such as exercise, meditation, and yoga. If you've had depression before, you may be more likely to experience it again. If you have depression symptoms, get help. Care can help you feel better sooner. Conclusion. Depression is one of the most common conditions in primary care, but is often unrecognized, undiagnosed, and untreated. Depression has a high rate of morbidity and mortality when left untreated. Most patients suffering from depression do not complain of feeling depressed, but rather anhedonia or vague unexplained symptoms. All physicians should remain alert to effectively screen for depression in their patients. There are several screening tools for depression that are effective and feasible in primary care settings. An appropriate history, physical, initial basic lab evaluation, and mental status examination can assist the physician in diagnosing the patient with the correct depressive spectrum disorder, including bipolar disorder. Primary care physicians should carefully assess depressed patients for suicide. Depression in the elderly is not part of the normal aging process. Patients who are elderly when they have their first episode of depression have a relatively higher likelihood of developing chronic and recurring depression. The prognosis for recovery is equal in young and old patients, although remission may take longer to achieve in older patients. Elderly patients usually start antidepressants at lower doses than their younger counterparts. Most primary care physicians can successfully treat uncomplicated mild or moderate forms of major depression in their settings with careful psychiatric management, e.g., close monitoring of symptoms, side effects, etc., maintaining a therapeutic alliance with their patient, pharmacotherapy, acute, continuation, and maintenance phases, and/or referral for psychotherapy. The following situations require referral to psychiatrist: suicide risk, bipolar disorder or a manic episode, psychotic symptoms, severe decrease in level of functioning, recurrent depression and chronic depression, depression that is refractory to treatment, cardiac disease that requires tricyclic antidepressants treatment, need for electroconvulsive therapy, ECT. Lack of available support system, and any diagnostic or treatment questions. Antidepressant medications' effectiveness is generally comparable across classes and within classes of medications. The medications differ in side effect profiles, drug-drug interactions, and cost. The history of a positive response to a particular drug for an individual or a family member, as well as patient preferences, should also be taken into account. Most psychiatrists agree that an SSRI should be the first-line choice. The dual-action reuptake inhibitors venlafaxine and bupropion are generally regarded as second-line agents. Tricyclics and other mixed or dual-action inhibitors are third-line. And MAOIs, monoamine oxidase inhibitors, are usually medications of last resort for patients who have not responded to other medications, due to their low tolerability, dietary restrictions, and drug-drug interactions. Most primary care physicians would prefer that a psychiatrist manage patients requiring MAOIs. Psychotherapy may be a first-line therapy choice for mild depression, particularly when associated with psychosocial stress, interpersonal problems, or with concurrent developmental or personality disorders. Psychotherapy in mild to moderate depression is most effective in the acute phase, and in preventing relapse during continuation phase treatment. Psychotherapy is not appropriate alone for severe depression, psychosis, and bipolar disorders. For more severe depression, psychotherapy may be appropriate in combination with the use of medications. The most effective forms of psychotherapy are those with structured and brief approaches such as cognitive behavioral therapy, interpersonal therapy, and certain problem-solving therapies. Regardless of the psychotherapy initiated, psychiatric management must be integrated at the same time. Patients who live with depression, and their family and friends, have enormous challenges to overcome. Primary care physicians can provide compassionate care, important education, psychiatric monitoring, social support, reassurance, and advocacy for these patients and their loved ones.